Pagi, Prof.
Pagi. Sedang persiapan. Selamat pagi semuanya.
Selamat pagi, Prof.
Sampai pagi ini sudah berapa peserta yang hadir atau yang ikut nanti?
Ada 400-an, Prof.
Oh ya, selamat pagi Dr. Leona.
Pagi. Ini kita masih nunggu Prof. Cheng.
Iya, bagus. Saya sambutan 5 sampai 10 menit ya.
Iya, Prof.
Betul?
Ya.
Iya. Ya baguslah, nanti saya terangkan tentang tujuan kita mengadakan ini. Kurang lebih 400-an atau 500, belum sampai.
Kemarin 400-an, Prof. Yang
400-an.
registrasi.
Oh ya. Ini baru internet saya kok kacau ini ya. Tapi saya pakai ini aja dah. Dari HP-nya saya buka juga ya.
Iya, Prof.
Dari luar negeri ada dari Filipina ya. Saya lihat tadi ada orang bule juga ya. Halo, halo.
Pagi, Prof.
Iya pagi, ya pagi. Iya. Iya. Oh, dari.
Saya tak pakai headset ya. Ya. Pagi, Prof. Tes. Ya, halo, Prof.
Pagi.
Iya. Ya, ini laporan, Prof, untuk
Ya.
peserta kita 431.
Oke.
Kemudian dari luar FKWM 26, ada 26.
Iya.
Ini dari Semarang, Universitas Diponegoro,
Iya.
Universitas Negeri Semarang, kemudian dari UI Jakarta,
Iya.
dari Muhammadiyah Surakarta, dari Brawijaya Malang, dari
Iya.
UNER Wijaya Kusuma Surabaya, kemudian di Universitas Islam Malang,
Iya.
ada dari Rumah Sakit Syamrabu Bangkalan, RSUD Bangkalan.
Oh ya.
Kemudian Universitas Gresik, Universitas Bengkulu, Universitas Lampung,
Wah, cukup
lalu
luas ya.
Rumah Sakit Hermina Malang. Kalau yang luar, kemudian ini Perhimpunan Dokter Kardiovaskuler. Kemudian iya,
Teman-teman saya ini.
iya, Bro. Kalau
Saya
dari
pokoknya tak sebar.
dari luar negeri, dari Malaysia, Universitas Siak Kuala Lumpur, kemudian ada yang dari Filipina, ya Filipina, tapi tidak mencantumkan organisasi atau institusinya.
Oh, enggak apa-apa.
Ya, itu Prof. Jadi kalau yang dari luar negeri dari Malaysia dan Filipina.
Filipina. Oke, bagus. Ya, Pak Andi, mudah-mudahan sukses ini ya. Ini besok saya mungkin ini tertutup kita aja ya. Halo, Pak Andi.
Enggak, Prof. Enggak.
Pak Andi.
Enggak, Prof.
Oh iya iya.
Dokter Leona.
Halo guys, aku adalah Glenn Axel, salah satu alumni dari Fakultas Kedokteran Unika Widya Mandala, Surabaya. Kalian pasti sudah tahu atau bahkan dengar mengenai fakultas yang hits satu ini. Jadi FKWM adalah salah satu fakultas kedokteran swasta di Surabaya yang berdiri sejak 2011. Walaupun masih muda, FKWM ini sudah terakreditasi dengan B. Nah, tiap tahunnya rata-rata sebanyak 95%, dan apalagi nih, periode tahun lalu yang Agustus 2020, lulusannya sebanyak 100%, dan itu pun ada yang lulusan dokter nasional yang terbaik. FKWM sudah menghasilkan sebanyak 4 angkatan dokter yang sudah tersebar di seluruh Indonesia. Selain itu, mahasiswa-mahasiswi FKWM juga memiliki banyak prestasi, baik di bidang akademik maupun non-akademik. Dan bahkan ada yang melanjutkan studi di pendidikan S2 dan ada yang pendidikan spesialis. Dan bahkan ada yang mengabdi sebagai dokter perwira TNI Angkatan Laut dan bahkan Angkatan Darat. Nah, sudah tahu kan sedikit gambaran mengenai tentang FKWM? Sekarang kalian wajib tahu fasilitas dari FKWM. Pendidikan FKWM ini memiliki fasilitas yang memadai dan dosen yang sangat berkompeten dalam bidangnya. Dan FKWM ini memiliki 8 laboratorium untuk menunjang proses pembelajaran dan 2 lokasi untuk pelatihan skills lab.
Ruang ujian berbasis komputer, ruang manekin, ruang teater atau perpustakaan, dan fasilitas lainnya yang gak kalah keren.
Apalagi FKWM ini sekarang memiliki gedung auditorium yang sangat megah dan memiliki rumah sakit pendidikan yang sangat nyaman dan sangat besar. Gimana? Keren banget kan FKWM ini? Jadi kalian tunggu apa lagi? Come and join with us, Fakultas Kedokteran Unika Widya Mandala, Surabaya. See you there! Halo guys, aku adalah Glenn Axel, salah satu alumni dari Fakultas Kedokteran Unika Widya Mandala, Surabaya. Kalian pasti sudah tahu atau bahkan dengar mengenai fakultas yang hits satu ini. Jadi FKWM adalah salah satu fakultas kedokteran swasta di Surabaya yang berdiri sejak 2011. Walaupun masih muda, FKWM ini sudah terakreditasi dengan B. Nah, tiap tahunnya rata-rata sebanyak 95%, dan apalagi nih, periode tahun lalu yang Agustus 2020 lulusannya sebanyak 100%, dan itu pun ada yang lulusan dokter nasional yang terbaik. FKWM sudah menghasilkan sebanyak 4 angkatan dokter yang sudah tersebar di seluruh Indonesia.
Selain itu, mahasiswa-mahasiswi FKWM juga memiliki banyak prestasi, baik di bidang akademik maupun non-akademik.
Dan bahkan ada yang melanjutkan studi di pendidikan S2 dan ada yang pendidikan spesialis. Dan bahkan ada yang mengabdi sebagai dokter perwira TNI Angkatan Laut dan bahkan Angkatan Darat. Nah, sudah tahu kan sedikit gambaran mengenai tentang FKWM? Sekarang kalian wajib tahu fasilitas dari FKWM. Pendidikan FKWM ini memiliki fasilitas yang memadai dan dosen yang sangat berkompeten dalam bidangnya. Dan FKWM ini memiliki 8 laboratorium untuk menunjang proses pembelajaran dan 2 lokasi untuk pelatihan skills lab.
Ruang ujian berbasis komputer, ruang manekin, ruang teater atau perpustakaan, dan fasilitas lainnya yang gak kalah keren.
Apalagi FKWM ini sekarang memiliki gedung auditorium yang sangat megah dan memiliki rumah sakit pendidikan yang sangat nyaman dan sangat besar. Gimana? Keren banget kan FKWM ini? Jadi kalian tunggu apa lagi? Come and join with us, Fakultas Kedokteran Unika Widya Mandala, Surabaya. See you there! Halo guys, aku adalah Glenn Axel, salah satu alumni dari Fakultas Kedokteran Unika Widya Mandala, Surabaya. Kalian pasti sudah tahu atau bahkan dengar mengenai fakultas yang hits satu ini. Jadi FKWM adalah salah satu fakultas kedokteran swasta di Surabaya yang berdiri sejak 2011. Walaupun masih muda, FKWM ini sudah banyak 95%, dan apalagi nih, periode tahun lalu yang Agustus 2020 lulusannya sebanyak 100%, dan itu pun ada yang lulusan dokter nasional yang terbaik. FKWM sudah menghasilkan sebanyak 4 angkatan dokter yang sudah tersebar di seluruh Indonesia.
Selain itu, mahasiswa-mahasiswi FKWM juga memiliki banyak prestasi, baik di bidang akademik maupun non-akademik.
Dan bahkan ada yang melanjutkan studi di pendidikan S2 dan ada yang pendidikan spesialis. Dan bahkan ada yang mengabdi sebagai dokter perwira TNI Angkatan Laut dan bahkan Angkatan Darat. Nah, sudah tahu kan sedikit gambaran mengenai tentang FKWM, sekarang kalian wajib tahu fasilitas dari FKWM. Pendidikan FKWM ini memiliki fasilitas yang memadai dan dosen yang sangat berkompeten dalam bidangnya. Dan FKWM ini memiliki 8 laboratorium untuk menunjang proses pembelajaran dan 2 lokasi untuk pelatihan skills lab.
Ruang ujian berbasis komputer, ruang manekin,
This is our medical school facility.
ruang teater atau perpustakaan, dan fasilitas lainnya yang gak kalah keren.
Apalagi FKWM ini sekarang memiliki gedung auditorium yang sangat megah dan memiliki rumah sakit pendidikan yang sangat nyaman dan sangat besar. Gimana? Keren banget kan FKWM ini? Jadi kalian tunggu apa lagi? Come and join with us, Fakultas Kedokteran Unika Widya Mandala, Surabaya. See you there!
Ya, mulai.
Ya. Selamat pagi dan selamat datang kepada dekanat, dosen, Sivitas Akademika Unika Widya Mandala Surabaya, serta seluruh mahasiswa, mahasiswi Fakultas Kedokteran Universitas Katolik Widya Mandala Surabaya yang telah hadir pada acara kuliah tamu pagi hari ini. Perkenalkan, saya Dr. Andriong yang akan memandu jalannya acara pada pagi hari ini. Good morning and welcome to the Honorable Dean and Vice Dean, lecturers, academic community, and also to all our beloved students of the Faculty of Medicine, Widya Mandala Surabaya Catholic University, who are present at the guest lecture this morning. Please let me introduce myself. My name is Andreong, Doctor of Medicine, who will become the Master of Ceremony for today's guest lecture. Sebelum memulai acara pada pagi hari ini, izinkan saya untuk mengawali acara dengan doa. Doa akan saya pimpin secara Katolik. First of all, before we begin our guest lecture, allow me to open this event in a Catholic prayer. All respected participants are welcome to pray according to their own respective religions and beliefs. Attendees are cordially asked to take a prayer stance. Dalam nama Bapa dan Putra dan Roh Kudus. Amin. Selamat pagi Allah Bapa, Allah Putra dan Roh Kudus. Terima kasih ya Tuhan atas perlindungan-Mu selama hari kemarin hingga pagi hari ini. Sehingga kami semua dapat berkumpul bersama-sama meskipun secara daring pada pagi hari ini untuk mengikuti acara kuliah tamu. Kami memohon kepada-Mu ya Tuhan, Tolong sertailah dan lindungilah kami selalu, berkatilah kami, agar informasi yang akan kami sampaikan dan akan kami terima pada kuliah tamu pagi hari ini dapat bermanfaat bagi kami. Kemuliaan kepada Allah Bapa dan Putra dan Roh Kudus, seperti pada permulaan, sekarang, selalu, dan sepanjang segala abad. Amin. Dalam nama Bapa dan Putra dan Roh Kudus. Amin. Selanjutnya mari kita menyanyikan lagu Indonesia Raya, diikuti Mars Fakultas Kedokteran Unika Widya Mandala Surabaya. Peserta dimohon mengambil posisi sempurna. Step on the following agenda. I would like to invite all of you to sing our national anthem, Indonesia Raya, together. Then, followed by Mars Faculty of Medicine of the Widya Mandala Surabaya Catholic University. Participants are asked to take perfect attitude. Terima kasih. Selanjutnya, Mari kita dengarkan kata sambutan dari Dekan Fakultas Kedokteran Unika Widya Mandala Surabaya. Kepada Profesor Dr. Paul L. Talele, dokter spesialis bedah torak kardiovaskular konsultan, waktu dan tempat kami persilahkan. Before we start the lecture, I would like to invite the Dean of the Faculty of Medicine, Widya Mandala Surabaya Catholic University, to deliver opening speech in Bahasa or in English. Please welcome Profesor Dr. Paul L. Talele, dokter spesialis bedah torak kardiovaskular konsultan. Kepada Prof. Paul, waktu dan tempat kami persilakan, Prof.
Recording in progress.
Halo.
Ya, Prof.
Halo.
Terdengar, Prof.
Ya, ini baru-baru mati nih internetnya. Ya oke.
Ya, silakan, Prof.
Sorry. Sekarang sambutan saya.
Ya, benar, Prof. Paul.
Oke, kamu ulangi lagi coba.
Baik, Prof. Selanjutnya, mari kita dengarkan kata sambutan dari Dekan Fakultas Kedokteran Unika Widya Mandala Surabaya kepada Profesor Dr. Paul L. Talele, dokter spesialis bedah torak kardiovaskular konsultan. Waktu dan tempat kami persilahkan. Before we start the lecture, I would like to invite the Dean of the Faculty of Medicine Widya Mandala Surabaya Catholic University to deliver the opening speech in Bahasa or in English. Please welcome Profesor Dr. Paul L. Talele, dokter spesialis bedah torak kardiovaskular konsultan.
Good morning, ladies and gentlemen, my beloved Indonesian medical student. On behalf of Faculty of Medicine, Widya Mandala Surabaya Catholic University, I would like to express my warm welcome to our honorable guest lecturer, Professor Cheng Hwee Ming from University of Malaya. Also to all participants on this lecture. How are you, Professor Cheng? Hoping all the best of you. The purpose of this medical guest lecture are, first, it opened the horizon of Indonesian medical students to development, medical science and technology advances from abroad, especially in the 4.0 or 5.0 era. Secondly, to hear and see specifically about the progress of medical science and technology in every guest lecture from abroad. The third is to build collaboration and cooperation between Widya Mandala Surabaya Catholic University and Indonesian medical experts, including the doctors from foreign country and organizations like Diaspora Indonesia, International College of Surgeons, because I am a surgeon, Professor Cheng, and Deutsche Indonesia Gesellschaft für Zusammenarbeit. This is a cooperation between alumni Indonesia from Germany. Thank you very much once again, Professor Cheng, who is willing to give a lecture in the field of basic physiology and advances to our medical students. Today, the total participants around 531 medical students from Indonesia and also including from abroad like Malaysia and Philippines. And I hope your lecture can increase knowledge about the potassium transmembrane cycling patterns and open up insights to advances in advanced physiology. And finally, once again, thank you very much, Professor Cheng. And I hope in the future we can collaborate and you can give another lecture in others aspect. As a Dean of Faculty, Vidya Mandala, Catholic University, Surabaya, officially I open this guest lecture series. Have a nice lecture and God bless you all. Thank you.
Thank you.
Thank you, Profesor Paul. Acara selanjutnya akan dipimpin oleh Wakil Dekan 1, Fakultas Kedokteran Unika Widya Mandala Surabaya. Sebelumnya, mohon izin saya bacakan kurikulum vitae beliau. The following agenda will be hosted by the Vice Dean of Faculty of Medicine, Widya Mandala Surabaya Catholic University. Allow me to read his curriculum vitae beforehand. Handi Suyono, Doctor of Medicine, Master of Medicine. Graduated as General Practitioner in 2005 and graduated as Master of Medicine in 2010 from Faculty of Medicine, University of Erlangen. He is now the Vice Dean for Curriculum of the Faculty of Medicine, Widya Mandala Surabaya Catholic University. Kepada Dr. Handi, waktu dan tempat kami persilakan. I cordially invite Dr. Handi to host the event.
Thank you, Dr. Andrea as MC. Good morning, everyone. Good morning and welcome, Professor Cheng Ming. Today is happy and blessing Saturday. We thank to Professor Cheng. Okay. I will facilitate this guest lecture. Let me introduce Professor Cheng. Professor Cheng Ming is a medical physiologist expert from University of Malaya, Malaysia. He wrote a lot of articles and books, especially the physiology of kidney. Yeah. Our lecture today is also attended by participants from other region of Indonesia, example from Semarang, Jakarta, Surakarta, Malang, Bangkalan, Madura, Gresik, Bengkulu, Lampung, and also from overseas, Malaysia and Philippines. For participants, you can ask by writing in chat box, yeah, or speak directly in discussion session after this presentation. Please participant mute the microphone during the lecture. Okay, Professor Cheng, please, time is yours.
Right. Thank you, Dr. Handi. And thank you, the MC, Dr. Andre, and the Dean. Thank you, Professor Ahalele, for inviting me to have this talk with your students. This is my first formal contact with students in Vidya Mandala. So I'm very happy to be able to speak to the students. And I enjoy the good singing of the Indonesian national song, because this reminds me that 2 days ago we also had our Malaysia Day. Yeah, and also I like that you have a faculty song, faculty of medical faculty song. So we don't have a faculty song yet. So we are hoping to within the next few months have a faculty song after so many years in Kuala Lumpur. So this morning, in this brief time, I hope to stimulate the interest of the students who are learning physiology, so much of physiology in so short a time. So let me just start by sharing screen. Okay, can you see this? Yeah, I think I got the correct picture from Google of your university building here. This is normally just a map to remind me when I visit a new medical school in Indonesia, the location of that medical school. So, so one of the things in physiology is that there is an increasing amount of information that has to be learned by the students, and for the teachers, an increasing amount of knowledge that has to be taught by the teacher. So I found this quote, some of you may be familiar. So this is a quote from the wise King Solomon, and from the book of Ecclesiastes in the Bible, says that of making many books, there is no end, and much study is a weariness of the flesh. So I believe that very often students as well as teachers who are teaching feels a bit overwhelmed with the large amount of information. So this morning, this talk on potassium physiology is trying to give you, hopefully, a picture of the way in which you can see patterns and organize information in physiology. So we're only focusing on one fact in physiology, and that is the potassium transmembrane gradient. And we're going to see, hopefully, that just by looking at how this gradient, the same gradient, is repeatedly used in many different organs, that we will begin to appreciate that there is organization and order in the much information that we're looking at in physiology. And I hope that you can apply this kind of approach to the study of physiology, whether you are in first year, the second year, or whether you are a clinical students. So I also want to say that for those of you who are taking notes, the students, don't be in a hurry to write so much notes, because I'm going to ask Dr. Handi to make available this set of PowerPoint slides. So just sit back and relax, and hopefully you can enjoy this lecture. So we're looking at potassium cation transmembrane signaling patterns, and hope this becomes relevant to much of the physiology you are learning. So the first 3 points is shown here, that there is a transmembrane potassium gradient, and we will look at the role of potassium in neurotransmission. And then the third major point, which we will develop, is that the reason your heart can beat rhythmically and automatically is because of some contribution by the same potassium gradient. Now, this is just a fun picture. This is one of my little toy at home. So this is a hippopotamus. So I'll call it hippopotassium. Yeah, just to make it fun for the student. And this is one of my favorite physiology cup. We made a series of mugs, and this says physiology inspires. We were doing this when we were looking at the respiratory system. Now this morning, I'm very happy to involve some of your classmates, your friends in my talk to better engage the audience. It's a very big group here. So I've been doing this several times now. So in these 3 main topics this morning, I'm going to ask some of your friends or classmates to come and give a few minutes introduction to the first of these 3 topics. So you recognize them. So for the first topic, Harumi and Owen will present. And then for neurotransmission, Naomi and Reinhard will come on. And then the third topic on the role of the SA node, which involves potassium, Jovan and Stanley will take over. So I'm going to stop share now, and then the students will take over just for a few minutes.
Hi, Arumi. What's wrong? Why would you call me so early in the morning? Today is Saturday, you know.
Hi, Owen. Sorry for calling you so early, but I just can't this out of my head. I kept thinking about this all night and it drives me crazy.
What is it then?
Well, it's about our lecture. I just couldn't understand it clearly. This is what I've been thinking the whole night. What's the transmembrane potassium gradient? Could you please explain it to me?
Well, first of all, you need to know that in our bodies, there are potassium, right? Now, the potassium are located in the extracellular fluid and in the intracellular fluid. The amount of potassium in the intracellular fluid is 30 times more than in the extracellular fluid.
Oh, okay, I see. Then how do our bodies maintain that amount and keep it at normal level?
You see, to maintain that, our bodies have this pump called sodium potassium membrane ATPase. Now, when two potassium bind on the outside of the carrier protein and three sodium bind on the inside, the ATPase become activated. This activation clips one molecule of ATP, splitting it to ADP and liberating a high energy. This energy will then cause a change in the protein molecule, causing 3 sodium to be pumped out and 2 potassium to be pulled in. I think that is all I know. If you still have any question left, I think we should ask it to Professor.
I think that would be a great idea. Thanks for your explanation, Owen.
Thank you too, Harumi.
Okay, thank you, Owen and Harumi. And let's move on to the second group, Naomi and Raina, who will tell us a little bit about potassium's role in neurotransmission.
Good morning, Renat. So for today's class presentation, what are we going to talk about?
Good morning. So today we're going to talk about the role of potassium in neurotransmission. Have you read anything related to it? Or do you know anything about it?
I guess I've read it somewhere, but as far as I've known, potassium has a major role in neuronal excitability. To prevent the hyperexcitability from happening, potassium have to be taken up quickly. Actually, the role is depending on the inward of natrium and outward of potassium. So actually, it's important during action potential.
I see. So you are referring to a neurotransmitter, aren't you? I get it. You mean that potassium movement is involved in excitatory and inhibitory synapses, right?
Yeah, that's what I mean, but I'm still a little bit confused. So do potassium efflux involved in changes of either it depolarizes or hyperpolarizes the neurons?
Yep, that's right. Potassium has a major role in action potential, which involve depolarization and hyperpolarization. For depolarization, we have to understand that the membrane potential becomes more positive. But for the hyperpolarization, we have to understand that the membrane potential becomes more negative.
Oh, I see. That's mean depolarization and hyperpolarization occur when ion channel in the membrane open or close, depending on the types of ion that enter or exit the cell.
Yep, that's the whole idea. So, do you understand it now?
Yeah, thanks, but actually I want to know more.
Yeah, me too. Let's just hear from the professor's explanation then.
Great idea. Thank you.
Thank you, Naomi and Reinhard, for that interesting introduction. We will hear more of this. And then the reason your heart is beating automatically while you're listening to this lecture is because of the role of many cations. And one of the cations that contribute to the SA node beating automatically is actually potassium. So let's ask now Jovan and Stanley to give us a brief introduction.
Hey Jovan, how are you? Have you been doing good?
Hey Stanley, I'm fine. Thank you. How about you, Stan?
Yeah, I'm fine too, thanks. So have you read the lecture for today's class? We will be discussing about the role of potassium in heartbeats, you know?
Oh yeah, I've read some of it. From what I've read, potassium is a mineral that is crucial for normal cell function in the body, including heart muscle cells.
Yeah, that's right. The major role of potassium is maintaining normal body growth and controlling the body's acid-base balance as well as electrical activity in the nerves and heart.
Oh yeah, I forgot about that. So you mean that the pacemaker we have in our hearts needs potassium to work? Sorry, what I mean was the action potential that happen in the cardiac muscle, including the autorhythmicity.
That's exactly right. About the heart autorhythmicity, the SA node is the one that sets the pace for the rest of the heart. The excitatory or conducting cells of the heart are the fibers responsible for the autorhythmicity of the heart. And Jovan, do you know which ions that takes a role in cardiac action potential?
Yes, Stanley, from what I've read, there are three ions that takes a role in cardiac action potential. They are natrium, potassium, and calcium.
Wow, that's complicated. By the way, do you know there are 5 phases of cardiac muscle action potential?
Yeah, I've read it in our book. So phase zero, or also called as depolarization, when the cardiac cell is stimulated and depolarized occurs. Phase one and phase two are absent in SA node action potential. Third, phase three, or also called as rapid repolarization, when there's increase of potassium ion, the plateaus phase ends and the returns the cell membrane potential to the resting level. Lastly, phase four, or also called as diastolic depolarization, by reducing outward potassium current contributes to depolarization.
Wow, that's a whole lot of explanation. And do you know what are the main source of potassium?
Yes, Stanley, we usually receive potassium by consuming fresh fruits such as banana, orange, strawberry, tomato, spinach, beans, peas, and lastly, dried fruits. And by the way, Stanley, I think it's already time to go back to class or we'll be late to hear the lecture from the professor.
Oh yeah, you're right. Let's go now. Thanks, bro.
Thank you, Jovan and Stanley. We'll come to that phase four that Jovan and Stanley mentioned in a short while. So let me just elaborate on what the three groups of students has nicely introduced. So let me share screen again. Okay, the talk I'm going to give you is about 15, 16 points, so it's easy to follow. I'm just summarizing the main things that the students said. All living cells have a transmembrane potassium gradient. And as we've listened and heard, it is always 30 times higher inside the cell compared to the outside. And this is obviously maintained by the ubiquitous sodium potassium ATPase. So it's about 4 to 5 millimole outside, kept very low, and important to keep potassium concentration very low outside the cell. And inside the cell, the high intracellular potassium is maintained by this sodium. In this case, I call it potassium sodium, since our focus this morning is on potassium. And so you have this kind of relationship whereby the external potassium is not maintained by the ATPase. The ATPase maintain the intracellular, but the extracellular is maintained low by this hormone from the adrenal cortex called aldosterone. And this is a steroid hormone. Now, the main point this morning, as I said, is to see that many physiological mechanisms and events exploit this single transmembrane gradient to affect many processes in the body. So let me carry on. So this is an unusual diagram. This is my hypopotassium. So in recent years, we've published this recently, and I'm happy to send the papers mentioned here to students or teachers who are interested. We've tried to organize small pieces of information into a mental visual image so that students can hopefully remember them better and become more integrated. So this is the physiometric diagram of potassium. So the extracellular fluid here on one corner is actually very low, 4 to 5, and the intracellular fluid potassium here is always kept high. And the two molecules here, ATPase maintains the high ICF, intracellular potassium, and the hormone aldosterone maintains the very low extracellular potassium. And so you always have this transmembrane gradient. And so we're going to see in a short while several examples of how this same potassium gradient can be used to signal many, many different physiological phenomena. So let's move on. So this is just a little bit of information related to potassium. Don't be worried about memorizing the numbers. They are just average values. This is to show you that most of your total body potassium is inside the cell and much less outside. And so on an overall view of the amount of potassium you add to the body, about 100 millimole or milli equivalent, you find that some of that obviously is lost in the feces, most of that is reabsorbed. Now, because the extracellular potassium has to be kept very low, it is quite easy to increase this concentration. So every time you take any meal, you tend to increase the potassium in your body fluid. And so you find that out of the 100, most of that is actually excreted in the urine. And this is the role of the hormone aldosterone. So those of you who have already done renal physiology will know that the adrenal hormone aldosterone, one of the main key functions is to secrete potassium into the urine. Because every day in a normal meal, you tend to add excess potassium to the body. Okay, so this is, now let's move on to the next few points. So the resting membrane potential is actually due to this transmembrane potassium gradient. That's the first point. So small changes in the external or extracellular potassium concentration will immediately change the resting membrane potential. Okay? So the transmembrane potassium gradient is the main determinant of your resting membrane potential in all excitable cells, including the nerve and also the skeletal muscle cells. So if you want a tagline, this is, I call this potassium for life's potential, the resting membrane potential. Now, one of the group mentioned that the excitability of the nerve and muscle is affected by the potassium transmembrane gradient. Because if you change the resting membrane potential, it means that you change the degree of excitability. Because if you are hyperpolarized, your resting membrane potential is further away from threshold, and so on. So if you like this picture of the potassium, it is like potassium is in a gated community. I call this like condominium. I call it chelominium. Okay, potassium lives in a gated chelominium, and the control of potassium movement from the inside to the outside of the cell is gated. It's controlled by different stimulus. It behaves as if there is a gate. So, and I think most students will know this by now, that in the repolarization phase of action potential, the major impulse signal in all excitable cells, it is the efflux of this potassium down voltage gated channels that causes repolarization. So just imagine that the gradient is already there in all excitable cells, in fact, in all cells. And so once the voltage gated channel open during the action potential, the potassium, because it's much higher inside, will just flow outside and causes repolarization. Okay? So the next few points. Okay, now this is the second group of students talk about neurotransmission. So this is just another of my favorite cup. It says physiology lights up my gray matter. So this is again the physiometric diagram showing the excitatory post-synaptic potential and the inhibitory post-synaptic potential. Now in the EPSP production, most of the time you can have influx of sodium in the post-synaptic membrane. And so this produces a depolarization current. Okay. Now the other way in which you can actually depolarize the post-synaptic membrane is if you can reduce the potassium efflux, because potassium is a cation. So if you reduce the potassium efflux, you produce the same effect of an EPSP. So similarly, if you go to the inhibitory neurons, which in fact are more abundant than the excitatory neurons. Most of the time, you find that the iPSP is produced when you have an influx of an anion, and in most cases, it's chloride. But in some neurons, you can produce a hyperpolarized effect by increasing the potassium efflux. So if potassium, which is a cation, moves out more freely, you end up with less negative resting membrane potential in the postsynaptic membrane. And so obviously you see this example in what is known as a ligand-gated potassium channel, because the neurotransmitter are ligands, they bind to the gate, and in the inhibitory neurons, they tend to open the potassium gate. So potassium move out and causes hyperpolarization. In the excitatory neurons, in some of the neurons, the neurotransmitter actually closes the gate. And so you get a decreased potassium influx, and you produce the same effect as if you had more sodium influx. So again, you find that the same gradient for potassium can be exploited in the production of an EPSP as well as an iPSP in neurotransmission. Okay? Same gradient, but different target tissue. So let's move on. So let's talk about just point number 10. Point 11 and 12 will be explained a little bit by another three groups of students. So as Jovan and Stanley said, the pacemaker cells, the sinoatrial node, spontaneously depolarize due to three different cations: sodium influx, calcium influx, but there is also a contribution of a reduced efflux of potassium. It's very complicated. Three different cations, two coming in, and one, there's a reduced efflux that also contributes. And so this is a picture that you've seen. This is the pacemaker potential here, which is also called the pre-potential. So you have a decreased permeability to potassium that together with increased calcium and also increased sodium, this decreased potassium efflux also helps to maintain the autorhythmicity of the heart. So for the next 3 points in this talk, I'm very happy to include another 6 of your classmates or friends in this presentation. So here they are, looking very nice. Glucose sensing involves potassium. In lung physiology, there's a very interesting phenomenon called hypoxic pulmonary vasoconstriction. Adinda and Jennifer will tell us something about that. And lastly, Christopher and Raphael will tell us the role of potassium at the chemoreceptors in chemoreceptor oxygen sensing. So let's welcome them as I stop sharing here.
Hello, Maria. How are you? Long time no see.
Hi, Agis. Good. How about you?
I feel great. Signed up on a week. I'm very sad because we can't meet.
Of course. I'm also very sad that the pandemic situation requires us to study from home.
That's right. By the way, what are you doing, Maria?
I'm eating and watching drama. What's up, Agis?
Signed up on a week. I'm often lazy to exercise and always eat a kind of food.
Yes, I also like a sedentary lifestyle.
Oh yeah, I just saw the breaking news about diabetes mellitus. I think diabetes mellitus is caused by genetic. And what do you think?
Yes, I saw it. That's right. It's genetic, but it seems like a big body like me can also get diabetes mellitus as a result of obesity. By the way, do you know what diabetes mellitus is?
Of course, diabetes mellitus is a metabolic disorder characterized by an increase in the blood glucose level due to defect in insulin secretion and insulin action.
And then I'm read from several journals that diabetes mellitus is caused by damage to pancreatic beta cell in secreting the hormone insulin.
Do you know how the production of beta cell in pancreas?
Beta cells are unique cells in the pancreas that produce, store, and release the hormone insulin. Located in the area of the pancreas known as the islets of Langerhans, They are one of at least 5 different types of islet cells that produce and secrete hormone directly into bloodstream. The process after you eat will be digested by the body, and there is an increase in blood glucose.
Then?
So for that process, glucose will be broke into the beta cell in the islets of Langerhans. Glucose will be broke into be transported by blood as vehicle. After that, glucose will go through the process of glycolysis by producing ATP, resulting in activation of calcium channel closure in carrying cell. This will inhibit the release of K ions from the cell, which will cause a deposition stage of cell membrane followed by the opening of cell channel.
Wow, this is great knowledge new to me.
Of course. By the way, do you have a sweet tooth?
Certainly, good things my insulin response is efficient.
And you can thank you potassium cation for quick insulin response during postprandial hyperglycemia.
Sweet, and the glucose sensing involved flux physiology also. Actually, I'm still curious about this.
Oh, for more details, let's listen to today's lecture with Prof. Cheng about potassium in glucose sensing.
Okay, see you, Maria.
See you, Agis.
Okay, thank you, Agista Maria, for that introduction. I'm going to use the same diagram in a short while to explain what the students have presented about the role of potassium in glucose sensing. So let's move on to Adinda and Jennifer on some lung physiology involving potassium.
Hello, Adinda. Good morning. Long time no see. I really miss our campus already.
Hello, Femi. Long time no see.
Hey, Adinda.
Oh my God, you're right. Since doing this work from home for about 2 years already.
I know, right? It's all because of this COVID-19 pandemic.
By the way, talking about COVID-19, I just scrolled on Instagram and I found a picture of a man who got COVID-19. Do you know something about this, Femi?
I think I know what is that. That is hypoxia. Hypoxia is a condition where not enough oxygen makes it to the cells and tissues in the body. This can happen even though blood flow is normal. Hypoxia can lead to many serious, sometimes life-threatening complications. When hypoxia happens, our blood vessels will automatically vasodilate to supply more oxygen.
Wow, that's new to me. Do all blood vessels vasodilate during tissue hypoxia?
Well, almost all, except for the pulmonary vessels. That's why the man's fingertips turn blue. It means that the area doesn't supply by the oxygen from the bloodstream. Well, I think Adinda have a little bit problem with her connection, so I will
Yeah, just
continue
move
with
on.
this.
Yeah,
Okay,
Jennifer.
okay,
Yeah.
doctor. Actually, the pulmonary blood vessel uniquely vasoconstrict instead when hypoxic, and that is due to match the airflow to blood flow. Something also called ventilation or perfusion balance.
Oh, great. That is so much information, fam. Thank you so much.
My pleasure, Linda. For another information, let's listen to Dr. Cheng's lecture about potassium and pulmonary function.
Thank you, Adinda. Jennifer, we had small connection there. But let's move on to the last student presentation. Raphael, Christopher, please come on.
Chris, help me.
What happened, bro? What happened?
I cannot breathe.
Oh, so right now you're having a low oxygen level.
Maybe, I don't know. I can't breathe, man.
So do you know that when the peripheral chemoreceptor at the carotid bodies sense decreasing blood oxygen level, increase carbon dioxide level, or reduce blood pH?
So, what will happen next? Will I die?
Well, the oxygen sensing works by a membrane potential change at the chemoreceptor. The carotid bodies have glomus cells, which have O2 sensitive potassium channels that are inactivated when blood oxygen level decrease.
Wait. So potassium flux participated in O2 sensing.
Yes, sure. That means potassium cannot leak out of the cell and causes the cell to depolarize.
What should I do next? I still can't breathe. Help me.
Okay. You better call the ambulance, bro. Goodbye.
Hey, wait.
Thank you, Raphael, Christopher. So Christopher looks like a very calm respiratory physician. Yeah, okay, let's continue with the rest of the talk this morning. Thank all the students for trying to make some of their own unique presentation to engage the audience. So let's carry on. Okay, this is the same picture that was shown by one group of students. This is the beta pancreatic cells. And so obviously glucose is sensed at the corner here and eventually produces insulin. But the pathway from glucose sensing to the secretion of insulin is very fascinating. It involves obviously glucose entry through its own GLUT transporter. And then within the cell, the glucose eventually leads to the formation of this energy source, ATP. And in the family of potassium channel, these channels in the beta cells are sensitive to ATP. And it actually causes a closure of the potassium channel. And so what happens is that when you have every time you have a decreased efflux down this transmembrane potassium gradient, you tend to depolarize the cell. And then this leads to another set of ion channels. In this case, it will be the calcium channel. So once the cells are depolarized, because you have a reduction in the potassium efflux, then the voltage gated calcium channels open because of this depolarization of the beta cells. And so calcium comes in, and calcium, as in all cells, causes the exocytosis of the vesicles here that contains insulin. So again, you see the importance of this transmembrane potassium gradient in affecting the glucose sensing response to the production of the insulin. So this is one. The second one, as mentioned by the student, is in the entertaining narration by Raphael and Christopher. that your chemoreceptor has cells that are sensitive to detecting hypoxia. So again, it involves potassium channel. Okay, so the channels are obviously sensitive to hypoxia. And here we see again the same kind of pattern. There's a reduction in potassium efflux because of the sensitivity to hypoxia. So you could call this hypoxia sensitive potassium channel. The same thing happens again. The glomus cell, which is part of the peripheral chemoreceptor at the carotid bodies, becomes depolarized. The depolarization now opens again voltage gated calcium channel. Calcium comes in. So in this case, you have exocytosis of vesicles containing the mediator, which will then stimulate the sensory nerve fiber, and this will be transmitted as an action potential to the brainstem, the respiratory center. So again, right from the start, it is a potassium channel here, but the potassium gradient that initiates the whole process of hypoxia sensing by the chemoreceptor cell. The next one, this is what is known as hypoxic pulmonary vasoconstriction. So the students asked a question in their presentation: do all blood vessels vasodilate in response to hypoxia? Almost all, yeah, in skeletal muscle, in coronary vessels, in cerebral vessel. But the unique feature of the pulmonary blood vessel is that it actually vasoconstricts. Now, obviously that tells you that it is not a metabolic reason why you have this unique hypoxic pulmonary vasoconstriction. And the main reason is for you to listen to your respiratory module, if you have not done it, is this hypoxic pulmonary vasoconstriction is linked to a process called the ventilation perfusion matching in the lungs. Okay, so now let's look at the scheme. So again, you have the potassium channel here. So the hypoxia closes the potassium channel in the pulmonary blood vessels. So these potassium channels are obviously quite special. They actually closes when they sense hypoxia. So the same thing happened, reduce potassium efflux. And I think you can tell the story now. You depolarize, in this case, the blood vessel of the pulmonary vessel. Now you open voltage-gated calcium channel in the pulmonary blood vessel. Calcium comes in, and this is a smooth muscle, the blood vessel. And so when you get the rise in the calcium in the pulmonary blood vessel, it produces the pulmonary vasoconstriction. So again, potassium reduced efflux is communicated as a depolarization effect on the voltage-gated calcium channel. Calcium comes in this case, it produces a contraction. So let me move on to the rest of today's point, and I will give a summary. So just for the sake of completeness, to mention about potassium, one of the role of hyperkalemia, which happens actually where every time you exercise, the more you exercise, there tends to be more efflux of potassium because every action potential is accompanied by some efflux of potassium because of repolarization. And yet it's been found that the external slightly increased hyperkalemia can also function to vasodilate blood vessel. Remember we mentioned that during hypoxia, most blood vessels vasodilate. So in the exercise situation, the role of the slight increase in potassium also contributes to the vasodilation, for example, in the skeletal muscle, besides the role of hypoxia. So this is just exercise hyperkalemia. Potassium ions can also function as a vasodilator. So the last few points is point 13, we already mentioned, the unique vascular response of the pulmonary hypoxic vasoconstriction. Now let's move on to a few other examples. The reason you are able to hear this lecture, and I hope you are hearing it carefully, is because there are obviously sensory receptors in your inner ear. Okay, and these hair cells are actually depolarized because of another group of potassium channel. So in this case, it is an influx of potassium down what is known as mechanically gated potassium channels. Okay, so here you have a very important role of a transmembrane gradient down the hair cells membrane, okay, to give you the effect of producing the perception of sound. Okay, so this is what happens. Now, this is just what we said, that hypoxia in some cases can also produce increased efflux. And if that hyperpolarizes the blood arterioles, you relax the muscle and cause vasodilation. And the last example, I think we should mention this, in our Asian culture, for example, if you enjoy sweet and sour fish or something like that, so the sensation of sourness, which gives food its delicious taste, is because the sour sensation is produced when the proton in the sour food blocks the potassium channel in some of the taste receptor. And so again, reduced potassium efflux depolarizes the cell, and you get eventually an action potential sent to the taste centers in the brain. Okay, so I'm going to summarize all this now in about 9 points. The role of the transmembrane potassium gradient, or the integrated potassium physiology, in several areas in physiology, and the students, together with some of these points here, highlights the main mechanisms that you are seeing in the body. So you may actually, if you work through your physiology, discover and notice more action of this potassium. So let me summarize here. So before that, this is for your reference. This is just, as I said, the taste receptor, where you have, sorry, this is hair cells, right? Am I right? Oh yeah, so this is the hair cells, okay? In your inner ear, potassium influx, and so causes the perception, the action potential transmitted to the afferent axon. So if you think about the sensation of balance in your inner ear, it also involves the same transmembrane gradient. So the same transmembrane gradient in your inner ear is important for hearing and for the sense of balance. So this is just a taste receptor, whereby a proton blocks the potassium channel, and you get exocytosis, depolarize the cell, exocytosis of the vesicles, and that produces the action potential. So one of the things you notice that in many situations, there is a communication between the potassium and the calcium. We've seen many examples of this. As potassium efflux is reduced, it depolarizes the cell, it opens voltage-gated calcium channel, calcium comes in and releases the mediator or neurotransmitter and produces that perception or that sensation. This is a summary slide. 9P, it's all in P for potassium physiology. And as I said, you can probably add on more as you work through different areas in your physiology program. So these are all being presented by the student. So the polarized cell membrane, resting membrane potential in neurotransmission, we saw this in pacemaker potential, in pancreatic glucose sensing, in the peripheral chemoreceptors, in oxygen sensing, in pulmonary ventilation perfusion matching. This is called hypoxic pulmonary vasoconstriction. In listening to sound and the sense of balance, you need the potassium gradient going down the mechanically gated potassium channel. In the enjoyment of our food, anything that is nice and sour. And of course, the last point is that in some active tissue, you can have the effect of potassium in vasodilation. So I'm just to finish with the 1 or 2 more slides, I think. So, okay, this is, I'll just show you a cartoon as done by one of my students. And I try to get students' involvement, not only in some of my presentation, but one of my students has been interested to illustrate some of the physiology in the form of cartoon, and will encourage you to use your artistic skills to also do this. So this is a conversation between these two, I would assume, medical students. Do all cells have a resting membrane potential? Yep, all cells membranes are polarized. There's a resting membrane potential. And the girl asks, what's the purpose of this RMP, resting membrane potential? And then this person says, excitable cells like nerve and muscle convert the resting membrane potential to action potential. And so the next question, does it mean that the non-excitable cells also use the RMP? Yes. And the pancreas detects hyperglycemia and secretes insulin using a change in the resting membrane potential. This is obviously what we've seen in the role of the potassium in glucose sensing. Sweet, how does this glucose sensing work? And this is a problem-based learning question for you, and so on and so forth. And here we are reminded again that it involves both potassium and calcium channel. This is a series cartoon. The next one says, hey, look what I found, another resting membrane potential link cell signaling besides pancreatic glucose sensing. Membrane potentials are so cool. I hope you think so too. Oxygen sensing by chemoreceptors also involves potassium and calcium fluxes. Wow, that sounds so ionic. And then this is the explanation, such inspiring physiology. So my next slide is just to hopefully pass on the message that your human body is very well designed and created, so that as you work through physiology, try to identify together with your friends and maybe with the help of your teachers some of these repeating patterns in physiology, so that it makes learning physiology more organized in the midst of so much information that you are learning in the course of physiology. So let me leave you with this quotation about the wonderful creation of our body. And this is just showing you, now that I can't bring my grandson anywhere, I bring him on my Zoom lecture. This is my grandson that just turned 1 year old last weekend. Okay, so obviously as I see him develop, this is again a reminder that the physiology of our human body is such a marvelous event. And today we're just looking at one single transmembrane potassium gradient, and we see how that same gradient can help us understand quite a lot of important physiology processes in the body. Thank you very much for listening. My apologies for this background that is not flipped the right way. I'm not very good at the computer, so obviously it's.
But it's okay, Professor Cheng. It's very nice and valuable lecture. Because I'm a cardiac surgeon, this potassium play a very, very important role for the cardiac function after an operation. Okay, thank you once again. And now we come to the discussion. Please, Dr. Hadi.
Yeah, thank you, Professor Cheng. Nice talk about potassium. So we learned today about the importance of potassium in our body, in our life. Okay, please, if anyone wants to ask a questions, please click raise hand first if you want to speak directly. The participants can also write in the chat box if you want to ask to Professor Cheng. Okay. This is from Aryani. Aryani. Okay,
Hi,
please, Aryani. Okay, Jovan, okay, welcome.
Hi, Jovan.
You can ask.
Thank you, Dr. Hani.
Yeah.
Professor Cheng, I would like to ask about how hypokalemia could cause a muscle weakness.
Cause what, sorry?
Muscle weakness.
Yeah, so as your friends introduced, that the changes in the potassium concentration outside the cell affects the resting membrane potential. So when you have hypokalemia, you actually the transmembrane gradient is changed. So it's a steeper gradient now, and that tends to give you a more negative resting membrane potential. So that means that it takes you will require a bigger stimulus for the more negative resting membrane potential to reach its threshold. And so because of that, this happens in both the nerve that innervates the skeletal muscle as well as the skeletal muscle itself. So that is why the person experience in the case of hypokalemia some muscle weakness, because so that is a symptom. So it's an electrolyte imbalance. In this case, it's a hypokalemia.
Okay, that's good questions, and Professor Cheng gives clear explanation. So this is the relevance of clinical condition in muscle weakness. We often find muscle weakness in clinic problems. Okay, next questions. Please raise hand, click raise hand first before you ask the questions. Okay, Dr. Swandito. Okay, please, Dr. Swandito.
Hi, Doctor.
Yeah, nice to meet you, Dr. Professor Cheng. It's a very interesting lecture we have today. So I have a question also. In clinical setting, if the patient have a hyperpotassemia, so we give the patient with insulin with some procedure to put back the potassium from the extracellular to intercellular. So would you like to explain it more how the mechanism is
yeah,
exactly? Thank you.
Yeah, thank you. Yeah, so because the concentration of potassium is low, about 4 to 5, so small changes can actually interfere with function. And as Professor the Dean said, especially cardiac muscle. So it's very important to maintain low potassium concentration. So in emergency situation, when you have hyperkalemia, one of the things that is given is insulin, because insulin has an effect in increasing the cellular uptake of potassium into the cell. So this apparently works through stimulating the sodium potassium ATPase. So it stimulates the ATPase, so the excess potassium is returned back into the cell. And obviously you can't just give insulin, because insulin, everybody knows, also reduces the glucose level. Yeah, so you need to give insulin with some glucose. Yeah. So that normalizes the potassium and doesn't produce a secondary decrease in the glucose.
Yeah, but in cases of hyperglycemia, it is also including with the hyperkalemia. So in this case, I think maybe this is okay if you give only the insulin and just monitoring the both the glucose and the potassium.
Yeah. So what Dr. Swandito is saying, just for the sake of the students, is that for example, in diabetes, which is not well controlled, you have both hyperglycemia as well as hyperkalemia. So in that case, if you do give insulin to help the patient, you don't need to add, obviously, the glucose, because the glucose is already high in that patient group.
Okay. Thank you, Professor Cheng, for your explanation.
Thank you.
Okay, thank you, Dr. Swandito, for these questions. That's important for us to manage diabetic patients. So we need knowledge about potassium. Okay, next questions. You can speak directly. Please raise hand first. Okay, Stanley. Okay, please, Stanley.
Hi, Stanley.
Hello, Prof. I want to ask Prof, what is the first line of treatment when someone comes to you with hypokalemia?
Low potassium.
Yes, yes, Prof.
I don't have the experience because I'm not the clinician. Yeah, I assume there will be potassium supplement because I don't have the clinical experience. Yeah, you have to check with your with your clinician. Yeah, I would assume that there must be some kind of potassium supplement that is given.
Okay, Prof. Thank you.
Okay, we can find many products in the market about ions, about beverage, the ions to provide or to restore our ions. Example, Kalium, potassium. So okay, maybe from clinician, any comments about this potassium supplement? Okay, Dr. Ari Yuwana, please.
Good morning,
Hi, Ari.
Dr. Cheng.
Hi.
I want to know what is the most common cause that makes a decrease in potassium in the elderly. Yeah, still active elderly. I mean, still active. Okay, thank you.
So yeah, so this is I wasn't aware of this. This is a common observation in elderly low potassium.
Yeah, but what might be the cause of that low potassium?
I don't know if as an immediate answer, why would be with aging that the potassium concentration tends to be lower. what would be the value in the elderly with this observation? Is it about 3 or is it, what is the average potassium concentration in the elderly? Is it lower than normal?
No, I think it's just the same as normal population.
Oh, but you were just asking me what is the cause of low potassium. So,
Yeah.
So I don't have the knowledge. So that's why I'm asking you, how low does the potassium level go in the elderly?
I sometimes got patients with low potassiums with muscle weakness, especially with muscle weakness. And after examinations, we know that the potassium levels is lower than normal population. Yeah.
Yeah.
So I become curious. What might be the cause of that
potassium
decrease? Yeah.
Yeah, I don't really know at this stage. So, but I will be interested to find out myself. Yeah. I wasn't aware of this observation that that their general muscle weakness could be due to this electrolyte. Yeah.
Yeah.
Thank you. Thank you for pointing that out. Yeah.
Okay, Dr. Ari Yuwana, our senior psychiatrist.
Yeah. Thank you.
Thank you. Thank you for the question.
That's good questions. Yeah, then if we look at the patients with low potassium, so we ask the questions, what happens to these patients? Is it related to the clinical problems or not? Yeah, or independence, the problem, or it's the cause. Yeah. So we have to look for the relevance.
Yeah. I think I'm thinking perhaps it is because food intake, or is there any what do you call it?
Some hormonal imbalance.
Renal cause.
Yeah. Normally renal cause, my impression is that more commonly it would be hyperkalemia, because renal function, as we showed in the slide, one of the main function is to secrete the excess potassium. So my guess is that for the elderly, it may be dietary that causes the low potassium rather than the renal cause. Because normally when you have a renal cause, the problem is a hyper rather than hypo.
I see. Thank you, Professor Cheng.
Thank you, Ari.
Okay, another questions, please. Raise hands first. Okay, from Harumi. Okay, Harumi, the actress.
Okay.
Hi, Harumi.
Okay.
Hello.
Welcome.
Prof. I would like to ask you about how can we differentiate between an acquired and congenital muscle weakness that is caused by hypokalemia?
To distinguish between acquired and
congenital.
Yeah, I suppose you have to go for the laboratory test. And I think if your hospital laboratory has some of this muscle physiology lab, they can take a biopsy and look at whether there's any changes either in the enzyme or things like that. Yeah, but they won't do that. The first thing they normally do is just to check your electrolyte. Yeah, you always do the common one first, unless it is necessary to look at the muscle biochemistry or even some of the genetic causes of muscle dysfunction.
Okay, thank you, Prof.
Okay, thank you, Harumi. Maybe we will talk later about the pathology of muscle weakness, okay, or pathophysiology of muscle weakness. Okay, maybe we have questions from YouTube. No questions from YouTube. Okay. We share this lecture on YouTube live streaming also. Okay, next question, please raise hands first. So we talk about potassium, and I write so many connection potassium with other function, examples nerve system, cardiovascular, respiratory, muscular, endocrine, special sense, yeah, hearing and taste, and also renal function. So related to organ system, almost all in our body. Okay, from me, Professor Cheng, yeah, if we look at the potassium role in nerve system, okay, how about the potassium role in brain, especially in limbic system?
In the brain, yeah, it's obviously the resting membrane potential in all neurons, whether it's in the peripheral or in the brain, are affected by potassium. So that's why one of the main function of your astrocytes in the brain, some of you may know the astrocyte, is to actually take up the excess potassium so that you maintain optimal low potassium in the brain tissue. Yeah. So if you look up astrocyte, you find that it actually can take up excess potassium. Yeah.
Okay. How about in limbic system, especially?
It should be the same because the limbic system is just the name of a group of neurons involved in a specific function in behavior, memory, or that. So it doesn't matter. Neurons are all neurons. They have resting membrane potential, and they will be affected by the same changes in potassium. So you either make the neurons more excitable or less excitable, depending on the concentration of potassium also.
Okay, thank you for your explanation. We need very, very important about potassium in our brain.
So yeah, so normally in a big group online class, online talk, yeah, there tend to be fewer questions because everybody is either waiting for one another. So as I said, I will send my PowerPoint slides for Dr. Handi. You're welcome to have them. And then if you do have questions after you read through, some of you may be junior years, you may not be following as well. Some of you may be senior years. So this most of these are revision. But feel free, I welcome students to contact me if you have further question. And the 12 students, they have my WhatsApp number. So you just ask them for my WhatsApp, the 10 students who have done a nice work in order to try to engage you all. So they are all in contact with me now. And so I thank them again for making this a bit more fun for all of you. I hope you enjoyed the presentation. And yeah, so I would be happy to hear from you if you have any questions in the revision of the physiology.
Okay, thank you, Professor Cheng, for this lecture. Very useful for us. We open the mind about the role of potassium. Yeah. So I can summarize about the potassium transmembrane signaling pattern. Yeah, potassium is very useful in our cells, in our body. It maintains the function of nerve system, respiratory, cardiovascular, renal system, muscular, endocrine, special sense, and all the process of cells also need the calcium. I'm sorry, the kalium or potassium. Potassium is important to maintain our life. Okay. I will return to MC, Dr. Andre. Before that, please fill the form of attendance. You can look at in chat box. Yeah. Please fill it, your attendance. Okay. I will return to MC, Dr. Andre Young. Please.
Terima kasih Dr. Handi, terima kasih Prof. Cheng Hwee. Thank you Professor Cheng Hwee for your fantastic presentation. Thank you Dr. Handi for hosting the event. We are very excited to hear updated knowledge related to kalium transmembrane signaling pattern. Acara akan dilanjutkan dengan penyerahan sertifikat secara simbolis kepada narasumber oleh Dekan Fakultas Kedokteran Unika Widya Mandala Surabaya. Moving on to the next agenda, we will continue to witness the symbolic handover of certificate to the speaker by the Dean of the Faculty of Medicine, Widya Mandala Surabaya Catholic University. Kepada tim IT, mohon bantuannya untuk spotlight Profesor Cheng, Profesor Paul, share screen sertifikatnya serta dokumentasi. Baik, mungkin yang di spotlight Profesor Cheng, Profesor Paul, dan share screen sertifikatnya saja untuk teman-teman tim IT. Nanti mohon bantuannya juga untuk tim IT bisa mendokumentasikan penyerahan sertifikat secara simbolis dari dekan kepada narasumber. Oke, mungkin mau ditunggu sebentar. Please kindly wait, Professor Cheng, Professor Paul, for the certificate to be shared by our IT.
Yeah, please be patient. We are going with potassium
Okay, this is our appreciation to you, Professor Cheng.
Thank you.
Once again, on the behalf of Medical School, Widya Mandala, Surabaya Catholic University, once again, thank you very much for your valuable and interesting lecture, and might increase our medical students' knowledge and of view how it's happened in the body. Focus on the role of potassium, and this is our certificate to you.
Thank you.
It's online. This is now we are all the new character and new problem in online. Sometimes IT is not in good function, and then after that now it's finished. And finally, once again, thank you very much. God bless you.
Thank you, Paul. Yeah.
Okay, thank you, Professor Paul, Professor Cheng. Kami berharap agar informasi yang telah kami sampaikan siang hari ini dapat berguna bagi Bapak Ibu serta mahasiswa-mahasiswi sekalian. We hope this information that have been delivered by the speakers this afternoon may enhance our knowledge about biochemistry related to Kalium transmembrane signaling pattern, and we hope it can be useful for the participation and all of our students. Sebelum kita akhiri acara pada pagi dan menjelang siang hari ini, mari kita tutup dengan doa. Doa akan dipimpin oleh Dr. Alvin. Kepada Dr. Alvin, waktu dan tempat kami persilahkan. Before we conclude our guest lecture, let's close this event by saying a prayer. Dr. Alvin Julian will lead the prayer.
Thank you, Dr. Andre. Sebelum kita mengakhiri kuliah pada pagi hari ini, kita akan tutup bersama di dalam doa. Doa akan saya pimpin secara Kristen. Mohon para hadirin bisa menyesuaikan. Marilah berdoa. Tuhan, terima kasih atas berkat dan penyertaan yang Engkau berikan sepanjang pagi hari ini. Kami telah Kau kumpulkan bersama mendengarkan kuliah yang telah disampaikan oleh Prof. Cheng Hwee Ming. Kiranya apa yang telah kami dengar, apa yang telah kami serap pada pagi hari ini dapat kami manfaatkan dan dapat berguna untuk masa depan kami sebagai dokter kelak. Kami juga berdoa bagi teman-teman kami yang masih belum bisa hadir bergabung di dalam Zoom meeting ini, kiranya Tuhan memberkati dan menyertai mereka dalam aktivitasnya, dalam pekerjaannya, sehingga juga Engkau selalu melindungi mereka di dalam aktivitas dan pekerjaannya. Kami juga berdoa Tuhan, setelah ini kami akan kembali melanjutkan aktivitas kami masing-masing, kiranya Tuhan berkati dan sertai aktivitas kami, sehingga aktivitas kami dapat berjalan dengan lancar tanpa kendala suatu apapun. Dalam nama Tuhan Yesus, kami sudah berdoa dan mengucap syukur. Amin. Saya kembalikan kepada Dr. Andre.
Baik, terima kasih Dr. Alvin. Thank you Dr. Alvin Julian. Selanjutnya, acara kita lanjutkan dengan sesi foto bersama. Kepada seluruh hadirin, dimohon menyalakan kamera dan menggunakan virtual background yang sudah di-share di kolom chat atau sudah di-share sebelumnya. Now, we will continue with group photo session. To all participants, please turn on your camera, and we will appreciate if you can use the virtual background for this guest lecture that already been shared yesterday or in the chat. Kepada tim IT, kami mohon bantuannya untuk memimpin sesi foto bersama pada kuliah hari ini. Saya foto ya, dokter. 1, 2, 3. Again, 1, 2, 3. Sudah dokter, terima kasih. Baik, terima kasih teman-teman IT. Saya mewakili panitia. Mohon maaf jika ada ucapan kami yang kurang berkenan selama berlangsungnya acara pada siang hari ini. Akhir kata, saya selaku pembawa acara pamit undur diri. Sampai jumpa pada kuliah tamu berikutnya. Selamat siang dan salam Widya Mandala. Finally, on behalf of the committee, allow me to express my sincere apologies for the unintentional mistake and inconvenience that followed. Thank you very much for your participation in this event. I hope we can meet again in the next guest lecture. Stay safe and healthy. Good afternoon and salam Widya Mandala.
Okay, thank you, Prof. Cheng.
Thank you.
Bye.
Bye-bye.
Bye bye.
Thank you, Prof. Cheng.
Yeah, see you. Yeah. Oke, mungkin panitia bisa tinggal sebentar ya. Saya perlu langsung kita evaluasi. Bentar. Yang lainnya bisa diinikan.